Were you able to get that stream going as well?
Yes.
Okay. Were you able to get that stream going? Okay, here we go. Thank you, everyone. Welcome. Today is January 27th, 2021, and we've got a briefing for you today that is largely focused on updating where we stand with the effort to vaccinate Vermonters and Chittenden County residents. Today is a hopeful milestone day in that effort. Community vaccinations began earlier today here in Burlington and around the state for members of the general public who are 75 years and older. And we're going to talk about that, talk about where we stand in the vaccination effort and what to expect going forward. We could advance here, Olivia. We want to start by just running down some of the statistics about where this phase 2 of the effort stands. So on Monday morning, the state opened up appointments for all Vermonters 75 years and old and older. There are about 50,000 Vermonters who fit into that eligibility category. And so far, 29,000 have signed up for appointments over the next 5 weeks. So there's still a significant population that still needs to sign up, and we want to speak to that a little bit further so far today. Here in Chittenden County, healthcare workers and residents of long-term care facilities have already, the great majority of those people from those populations have already been vaccinated. That means that here in Chittenden County, nearly 1 in 10 people has already received at least 1 dose of the vaccine. And we have a chart up where you can start to see how those vaccinations are breaking down. And this is all up on the city's dashboard. We recently expanded the dashboard to have a lot more metrics about vaccinations. So if you can't quickly kind of pick up all the information here, you can find that at the city's website. You can get to the dashboard with links straight from the homepage. This 1 in 10 stat is the highest of any county in the state because of the combination of how many healthcare centers we have here in Chittenden County, as well as the fact that a disproportionate number of the long-term care facilities in the state are based here in Chittenden County. So, still clearly a long way to go, but a tenth of the way there is, especially that 1/10 being the highest risk members of the state is a sign of real progress. So again, the vaccinations began here in Chittenden County and in Burlington earlier today. There are several locations in Chittenden County where people 75 and older can receive the vaccine. One of those locations is here in Burlington at the Integrated Arts Academy in the Old North End. This is one of our elementary schools, of course, that is closed on Wednesdays. So that makes it a good location for today, the start of the beginning of this effort. The site opened this morning at 9 in the morning and is expected to close at 3 p.m. And then the site will be closed until the next round of doses is received next Wednesday. Right now, the pace of the distribution here in Chittenden County is planned to be just that, 1 time a week, although we certainly are all hoping that more supply will materialize more quickly and this can be expanded. I had a conversation this morning with Heather Danis, who is the Vermont Department of Health Services District Director, and she is managing the site. And we had a good conversation late in the morning. She reported to me that there was a very exciting moment when the vaccinations began. She said pretty much everyone in the room had tears in their eyes as the effort started this morning. There was applause. I am really grateful for the work that team and so many others have done to reach this milestone. It sounds from Heather like things are going as smoothly as could be expected. There has been what you would expect, a little bit of some moments where there were modest lines, but they were working through that and getting this new operation running smoothly. She did, a point she made that I think we all should keep in mind as we, over the weeks and months to come, experience this system, is that it is a tremendous undertaking involving literally the integrated efforts of thousands of people. And we all should be conscious of just what a new, unusual, unprecedented event this is as we experience, as we go to get our vaccination and experience this. Certainly there are many people focused on making it run as smoothly as possible, but especially right now, as we're just getting it started, there may be minor inconveniences as this is getting stood up. It's important to note that there are only 150 doses that are available right now for today, and that's what's expected for next week. We're all hoping again that changes, but this is a system where you need an appointment. Walk-ins are not accepted. And further, once you secure your appointment through the state's website or the call center, it's really important that you keep the appointment so that this balance system is not thrown off by absences. I said to Heather that of course the city is here to support the state's effort in any way that we can. And we've tried to play that supportive role to the public health effort from the beginning, helping the state with pop-up testing sites, supportive quarantine programs, and the like. And the individual who has been on point, helping the city lead this effort for many months now is Brian Lowe. And Brian is joining today on the briefing. Brian is our Chief Innovative Officer as well as our COVID-19 leader. And Brian, why don't you take it from here? Maybe you can give it a little bit more detail on how phase 2 of the vaccination effort is going so far.
Mayor, I'm happy to do that. Thank you for the opportunity to be here. And congratulations to Heather and NVDH on starting that new clinic today. So phase 2 of the vaccination process is for those Vermonters who are 75 years old or older. You can make an appointment at this point if you meet that eligibility criteria. And as the mayor said, about 29,000 of the roughly 50,000 Vermonters who are 75 and older have done so already. The vaccine is free and it's safe. And all the appointments for these vaccines for the next 5 weeks were released on Monday by the state. So to make an appointment, you need to go to the state's website or to call the Department of Health. A line that's been set up. And the state website is healthvermont.gov/myvaccine. The call center number on the screen here is 855-722-7878. And those are the 2 ways to call and register. And what I would urge people to consider is think about your family and people who are older in your family. Think about your neighbors and who you might be able to assist to register for this. We've heard from a number of our community partners, AARP and others, that it's not always intuitive for folks who are 75 and older how to navigate some of these websites. And so taking that extra step and trying to help your neighbor, making sure that people in your family are registered, are able to register, is a really important thing for us to be doing over the next couple of weeks and probably over the next couple of months. As the mayor said, with about 8,000 doses a week arriving from the federal government and a population of roughly 50,000 for this age bracket, it will be a number of weeks before all folks in this age range are vaccinated. But good news too, in addition to the mayor's point about 1 in 10 folks in Chittenden County, or nearly 1 in 10, having already had their first dose, at least their first dose, Vermont actually was the first state to record more people vaccinated than have been infected by the coronavirus.
It's really an exciting milestone, a tribute both to the extremely low number of infections here in Vermont relative to other states, as well as the fact that the early stages of the vaccination effort appear to be going smoothly in comparison to other states here. We certainly are not aware of there being millions of doses sitting in freezers, as is somehow suspected in other parts of the country, and the rollout has been relatively smooth so far. I do want to just reinforce Brian's point and make it clear that the city is here to help with any difficulties that Burlingtonians face in trying to get an appointment or make it to the appointment. We have a ways to go to reach that full 50,000 person population. And then even once we have everyone signed up, I do have some concern that some folks, because of their circumstances, lack of access to transportation, other obstacles, might have difficulty keeping those appointments. If you or someone you know is having some kind of problem, some kind of barrier to getting into the vaccination system, please let us know. Call the Resource and Recovery Center yourself, or have them call. There's a phone number. You can also reach us by email. And we set up this Resource and Recovery Center staffed by city personnel to help with exactly challenges like this, when people are experiencing something related to this pandemic or the economic fallout where they need one-on-one assistance. So that's what it's there for. We hope people will use it if they do need help. At this point, we wanted to, I think, shift to just a little more discussion, just to review some things we've talked about in the past, what the city has been, the key areas the city's been focused on as we have communicated with the state, worked with the state over recent months to try to ensure that this rollout is as smooth as possible. We're really focused on 3 issues, and I just wanted essentially a short update on each of them right now. First, allocation. Initially, when we got some of the initial reports of how the vaccine might be distributed around the state, we had some concern that there might not be equitable, fair distribution. Sometimes in Vermont, we like to split things up by county, and that wasn't going to work here in a situation where Chittenden County is so much larger than all other counties. And we did get confirmation that about 21% of the vaccine each week is going to be headed to Chittenden County, because that's where 21% of the target population, the top population 75 and older, is. Chittenden County is actually, a relatively young county. We make up about 25% overall of the state's population, but only 21% of the population 75 and older. The second area that we've had a lot of conversations about, and I think we're going to need to keep talking about, although the fact that we were able to talk about that IAA site is an indication of progress here, is that transportation access and walkability is a big issue. About 15% of Burlingtonians do not own a car. So it's been a priority for us that there be a site accessible by foot and transit here in Burlington. And that's exactly what the IAA site is. I don't necessarily think that addresses all the issues. We will be, as this continues from week to week, we are in conversations with the state about other sites opening up as well. There could also be a need for transportation assistance in some way as we get further into this. Again, that's one of the reasons we're asking people to be in touch if they are having challenges. And then finally, it's been a major priority of mine and the city's that communication and outreach to immigrant, refugee, and BIPOC communities be as strong as possible. Over the last week, there's been a tremendous effort by the city and more than 20 partner organizations to share information about the vaccine and how to receive it with Burlington's BIPOC residents, and particularly elderly residents who have limited English proficiency. The key partners in this, who I would particularly like to thank, are AALV, USCRI, and LEND. And all 3 of those organizations have case management teams who work tirelessly through the weekend to ensure that people who they serve had the information they needed to sign up for vaccine appointments on Monday morning. And to say a little bit more about that, I'm really pleased to have one of the great leaders from this community, Yakuba Bogre, on the briefing with us today. Yakuba and his team have played a key role in communication with our immigrant communities throughout this pandemic. This was another big weekend. Yakuba, welcome. Thank you for your service to this community, and how is this effort going from your perspective?
Thank you so much, Mayor, for inviting us. And I would say that since the city and the state made it clear that this age group will be available to access the vaccine, our case managers at ALB have worked tirelessly over the weekend since Friday to call families that have eligible seniors to explain the process and also try to answer their question regarding the vaccine or direct them to the provider, the healthcare providers, if they have concern on the vaccine. And over the weekend, we were able to reach out to 72 families. And among those families, we were able to register when the link opened yesterday morning, 42 individuals that are 75 years and over, but also keeping track of a list of individuals that could be eligible for the next round of registration. So the case managers have been doing that, and also we reach out to our network of interpreters to call also on to some families that have been here longer enough, like some of the first group that were resettled in Vermont that tend not to be in the loop, like the Vietnamese, some of the Chinese that are available here, and some of the Spanish-speaking community, to see if in their midst they have seniors that could be helped to register. But so far, I would say that things have been going very well. And as of now, we are still registering people to at least access the vaccine, people who are eligible for this round of sign-up. And as I said, also, we are keeping track of a list of individuals who are under 75s that could be eligible for the next round of registration.
Great. Okay, that's excellent to hear that you're already planning for the next round. I know that that's on the minds of many Burlingtonians and Vermonters, and something that we will keep coming back to here on these briefings as we get closer to other rounds opening up, as there's more information about how those efforts are going to be conducted. Clearly, there is a huge effort going on at the federal level to try to increase the supply of the vaccine, which is obviously at this point the major constraint here in Vermont. We are in conversations with the state to try to ensure that as soon as there is greater supply available, the distribution system here in Burlington and statewide is there to get those vaccines into people's arms as quickly as possible. Again, Yakuba, thank you for your critical partnership at this stage of the pandemic, just as you played a big role in helping get the word out when we had outbreaks within the Old North End and immigrant community earlier in the summer. AALV played a key role in helping contain that outbreak, helping ensure that there was no fatalities in that outbreak. And then all the work you've done with the pop-up testing clinics, we really appreciate it. It's really felt like a time of real partnership between the city and so many other organizations. Thank you for your service.
Thank you so much for all your help and support also.
Why don't you stay here? We're going to move on to a couple other brief topics, but there may be questions about this, so don't sign off quite yet. And we really just had 3 other announcements. Unless Brian, did you want to say anything else about that effort? So here's the 3 other pieces of news. One, we wanted to share that at the request of the state, the city has extended our deployment of city employees to support the state's contact tracing effort for the last approximately a month. A dozen city employees have been assigned to the Department of Health 3 days a week to support their this critical effort of contact tracing, and we have now extended that collaboration formally with a contract extension for a second month. Second, our wastewater readings overall seem to show that infections are holding fairly steady. We see that in the number of infections every day, as well, that are confirmed by testing, and you can see that on the dashboard. If anything, we are starting to see we are down modestly from the peak of a week or so ago. This is consistent with national trends. We hope it continues. There are a number of reasons why it might not, including there are going to be many more tests taking place in the weeks to come, with students coming back into the Burlington area. That could kind of have an impact on what the local Chittenden County testing data looks like. More further, the big concern that continues to be out there and that we're all watching for is whether this generally downward trend of new infections is impacted by the new variants of the virus that are circulating around the world, and that we're looking for here. Again, we since our briefing last week, we have had another round of testing. We still have not detected new variants within the Burlington wastewater system. As we point out every time, a little bit of a disclaimer, that does not mean that it is not here. It is not at detectable levels, and we do believe that our technology would detect it at quite a low level, and so far no positives. Where we'll be testing again over the weekend. And then finally, I do just want to make sure that everyone knows, while we remain in this vigilant period, asking everyone to continue to mask and use good hygiene and social distance, all the practices that we have learned together over the last year. The key piece of testing within the community continues to be available at 405 Pine Street. And the state and the National Guard are continuing additional pop-up test sites in Chittenden County throughout February. There are pop-ups every week in Williston on Wednesdays, Colchester on Thursdays, and Burlington at the North End Studio on Fridays. And again, every day at 405 Pine Street, there's essentially a permanent testing facility there, for at least for the foreseeable future. And last report, over 400 tests a day are being conducted there. So that remains a very significant option. I think that's all we had. Brian, did you want to add anything else?
Mayor, just another kind of very quick short point, just that there are no vaccinations available at the testing sites. There's been some confusion about that. We've heard calls at the RRC about that. So vaccines are not available at the test sites. And while the overall trend is down in the kind of total viral prevalence, there are certain parts of the city, particularly in the Old North End and the downtown, where we're not seeing that kind of decline. There is still a modest increase in that particular neighborhood.
Thank you, Brian. With that, I see that we do have a number of members of the media with us today. Are there any questions, Olivia?
Yes, and reminder for members of the media, you can let me know that you have a question just by sending me an email, and then I will get you in the queue. And first up is Grace from VT Digger. Grace, you should be able to enable your microphone.
Great, can you hear me?
We can, Grace, go ahead.
So I've been hearing, and maybe you've been seeing this as well, some reports from other areas of the country where vaccination has opened up more, where people are scheduling appointments to go get vaccinated, but some don't show up for whatever reason, and there's 10 or so leftover doses of vaccine that have to be used, or they'll go bad. I'm curious, I know that the vaccination just started for the general population, but I'm curious if this is a concern that may arise in Burlington, and if you have any advisement on residents, staking out vaccination clinics to see if they can get leftover doses.
Thank you, Grace. I did talk to the woman leading the Burlington site about exactly that issue earlier today. Again, that was Heather Dennis, and she confirmed that they do have a plan in place if there is any leftover doses at the end of the day. It would only be a very small number of doses, she explained, and that once an individual package, or not even package, but a vial is open, they need to use all of that within a matter of hours. And so they are managing a list of people from the target population that they will, if they believe they are going to have some extra doses, they will have a way to make sure that vaccine is not wasted. They will not be able to accommodate any. People should not just show up and hope there's going to be some kind of leftovers. It's not going to work that way. But they definitely do have a plan in place to ensure that there the goal certainly that they're aware of is to make sure literally not a single dose is wasted of this valuable life-saving vaccine. Which interestingly, they have a little bit more flexibility than I had understood with some. I think the vaccine being distributed in Burlington, they have up until 5 days to use doses once it comes out of the deep freeze, which is more time than I had understood for in certain conditions. So they're very conscious of this, and they have a plan in place to make sure those really mistakes that we have seen in other parts of the country are not repeated here.
Gotcha. And something I just wanted to clarify. So this vaccination site in Burlington, is it only open on Wednesdays once a week?
Grace, at this point, it is only open on Wednesdays, and that's certainly something that we are in close conversation with the Department of Health about. If we are told that the limit, the constraint is not the how many people could be vaccinated in a day there. They could, at this site, vaccinate as many as 400 people safely in a day. They only have the vaccine for 150 currently. But we do have questions and are trying to make sure there's a plan in place if we get to the point where there's even more supply than that available, that there still be other options that are walkable options within Burlington, and that this site is really only available on Wednesdays because it is a school site. Burlington elementary schools are closed on Wednesdays because of the pandemic, so it integrates well. If we see a significant increase in the supply, there may be a need to expand the number of sites or move this effort to another site. But for now, and for the 5 weeks, people who have signed up to receive vaccines at IAA, those are all Wednesday appointments over the next 4 weeks after today. Anything you want to add to that, Brian? Anything I didn't capture correctly there?
No, I think that's a good summary. I think there is another site in Winooski that will begin next week, comparable size. And I know that there are pharmacy sites across the state that are opening now as well. The Kinney's, almost every Kinney's across the state, including the one on Shelburne Road in Burlington.
Okay, gotcha. So when people sign up to get the vaccine, they'll be able to pick from these sites?
That's right. You can
Wednesdays at this one site in Burlington.
So here's my understanding, Grace, and I've tried to do a little bit of this firsthand to make sure I was understanding it correctly. But Brian, jump in here if you think I'm misstating something. But if you go, and maybe Olivia, you could even could share your screen. If you go to the website, this Department of Health website, where we are directing everyone to sign up for appointments, you will see there buttons both for the Kinney drug sites and for the general, the state vaccination sites. And so if you go and click on, you can, from there, you can see how they highlight, you can make an appointment at a Kinney drug site or with the health department. I will tell you right now, the Kinney drug sites appear to be entirely booked up for the weeks to come. The health department say it's a little bit more complicated. You need to register before you can see the availability. So I personally haven't past that phase since I'm not from one of the eligible categories yet, but that is the online way in which to sign up. And again, there are 20,000 some odd available appointments that should be still available through that system, given our understanding of where we stand with the sign up effort for individuals 75 and older.
And just so I'm understanding correctly, so if more vaccination doses become available, your intention is to find other sites for more days of the week?
Yeah, I think it's premature to say exactly how that would be handled, Grace. But I think what I can say is we are in conversations with the state, trying to make sure there is a plan in place. If there is an increase, as we all hope is going to happen, that increase of supply can be distributed in a way that's consistent with these principles that we've been focused on from the start, that there be access from walkable sites, that there be good communication with our BIPOC communities and English parts of the community that have challenges with English, and that there be a fair distribution. Exactly how that will be implemented is it's an ongoing matter of conversation. There could be considerable expansion at the IAA site, but if there was a more than fourfold increase, we would be looking at there being a need for some other way of getting that out. Do you want to add anything, Brian?
No, I think that's right. I think there are definitely conversations underway about what hours are most accessible to people, what days of the week are most accessible to people, what locations are most accessible to people, and all that really is a conversation with the Department of Health.
Okay, those are all my questions. Thank you.
Great, thank you, Grace.
Next is Lauren from NBC5, and Lauren, you should be able to enable your microphone now.
Hello.
Hi, Lauren.
So do you know how long registration will be open so far? I mean, for people in the 75 and older bracket, and will their opportunity to register end when the next age bracket is available?
Thanks, Lauren. So here's my understanding. And again, Brian, if you help me out here, if you understand things differently, the state has released 5 weeks worth of appointments, which cumulatively across the state, a total about 50,000 appointments, which is the size of the target population to the best that the state understands it here in Vermont. It is not clear yet when signups will be opened up for other populations. The state has made it clear that they are going to do this by age going forward. That I think it's been my understanding is it's been stated that the next stage will be for individuals 70 and older, and then they will move to 65. The timing of that and how exactly how that will be integrated, I don't believe has been determined, or at least not announced at this point.
Okay. And then is anyone on standby after people get vaccinated? Is there someone, or are people required to wait, 10 minutes or something after they get vaccinated just to see if there's any type of initial reaction?
Yes, that's my understanding, is that people are advised they should stay on site for approximately 15 minutes for observation before they should leave. People are asked to do that just in case they are one of the very rare number of people that have some kind of negative reaction to the injection. I believe there have just been a handful of reactions like that reported internationally. So it's really and millions of people have now been vaccinated. So we really discourage people from holding back from getting a vaccination because they are worried about some kind of side effect. But just in case that protocol is in place. People are asked to stay on site for 15 minutes for observation.
Okay, and then I'm not sure if you answered this already, but is that 9 to 3 time slot also at Kinney Drugs, or is that just at the health department locations?
So I don't know the hours that the Kinney Drug signups were for, and again, they now appear to be all booked up for the coming weeks from our review of the website earlier. I'm not sure. My understanding is, it's a smaller number of doses being distributed that way. At one point, we heard from the Department of Health that they expected, like, the Burlington site to have about 20 over the course of a week. Exactly how those appointments are being scheduled, I can't address. Do you want to add anything, Brian?
I don't know the exact hours at Kinney either. I do know that they are on different days when those slots are available. The 9 to 3 timeframe is for the Wednesday clinic at the IAA only, and I don't know the timelines of the other clinics.
Okay, thank you so much. Oh,
no, I just was noting in the chat that one of our great city employees who works at the library just reported in the chat that her parents got vaccinated. My parents have an appointment to get vaccinated down in the Upper Valley area next week. It is really quite an experience we're all going through, working to get our older generation safely to shore here with these vaccinations that, again, they have proven to be so effective. It is a really significant milestone when a family member becomes eligible. So let's all keep working together to keep everyone, to minimize the number of new infections that take place. In the coming weeks, we remain in this critical race to get our vulnerable populations vaccinated before the virus spreads further locally. Burlingtonians, Vermonters have done an incredible job. Let's stick with it through these critical weeks. Do we have anybody else, Olivia, or was that it for today?
We don't, and that is a good place to end.
Excellent. So thank you, Olivia, for your help. Brian, Yakuba, thank you for joining us on the briefing. We will be back. Again, we plan to continue giving these updates about once a week. We will see everybody next week. Stay safe out there. Take care.